Serious depression affects 10 million Americans every year. As many as 15% of us suffer from it at least once in our lives.
It's like you're walking down an empty tunnel with no end in sight.
Just like never-ending sadness. Like you think nothing will ever get better.
It's a slowing down of a lot of your of the body functions and even of the way you think.
Although depression can happen to anyone, women are twice as likely as men to be diagnosed with it. A death in the family or a serious illness may be the cause, but depression can also occur for no apparent reason. We'll take a look at electroconvulsive therapy, a treatment with a bad reputation that with important changes has made a comeback. We'll look at research and examine some of the controversial new treatments like Prozac.
Depression, while it's very common and very debilitating, is thankfully also very treatable now. And that people of any age, from childhood up into the very elderly, can be successfully treated for depression, and people should not feel hopeless about it. If they feel blue, they can get help with that.
Hello, I'm Jamie Guth. Most of us have felt depressed at one time or another. It can be from problems at home or school or work. But that feeling of sadness usually goes away in a couple days and doesn't keep us from doing the things we need to do. The kind of depression we're talking about today is much more serious.
And I said, all I can hear is Marshall calling me, and where is he, and what can I do about it? I don't think I knew I was that depressed. I was just kind of paralyzed.
Peg Chatelier considers herself an optimist, but her sense of security was shaken at the age of 28. She had moved with her husband and children to a small northern town in Michigan to run a resort, but within months there was a fire.
I took the children out, put them in the car, but we had 3 of them then, and one was small. And then realized the oldest child, who was 8, had gone back into the building, gotten into bed, and there was no way we could get, absolutely no way we could get to him.
Peg's son Marshall died in that fire. Peg was pregnant at the time, but shortly afterward miscarried. She doesn't remember how long afterward or how long she was in the hospital. She thinks it was about 10 days.
I think I blocked out a bunch of things, and my husband did not want to talk about it. And I think this was what almost did me in, because I had real need after that to talk about it.
In many parts of the country, talking has been the preferred, and up until 35 years ago, the only form of treatment for depression. Peg was visited by a priest in the hospital who helped her back out of what she calls her paralysis.
But as he talked with me, somehow I started to have a feeling of peace.
There are hundreds of forms of talk therapy and many different people who can help. Robert Santulli is a psychiatrist at the Dartmouth-Hitchcock Medical Center.
For many people, talking treatment is what they need, and really all they need to feel better. By that I mean psychotherapy, talking out what's on their mind with an interested person who's skilled at being able to understand, to give them some meaningful feedback, and help them to resolve whatever it is that's causing them the stress that's leading to their depression.
Today, the emphasis is on helping people through their problems much more quickly than in the past. Traditional Freudian analysis, where a person lays on a couch and talks about his childhood, can take years. While still in use, it's often combined with other therapies. Two of the more common ones are called cognitive and interpersonal.
Interpersonal therapy it is similar to the more traditional psychoanalytically oriented or psychodynamically oriented psychotherapy, but it places special emphasis on the individual's interpersonal relationships with others, as being significant. Cognitive therapy is based on the belief that people become depressed because their thinking is disordered around particular issues, around how they view themselves and how they view others, and is an approach that is designed to change not so much your emotions as your thinking, and the feeling is that when you can change your thinking about yourself, your emotions will feel better.
About half of all people who experience depression only do so once. Often it's caused by a traumatic event like a death. Some studies have shown that if people have more than 3 episodes and are not treated, they're at greater risk for chronic depression. Most people can come out of depression on their own, but treatment can get them out sooner, and in serious cases, it can prevent people from becoming suicidal.
When you reach a point where, life doesn't have to be as painful as it is, as it feels, then I, knew that I needed to talk to somebody and continue.
Sandy Jocelyn has been depressed on and off for a number of years, and a few months ago started seeing a therapist.
There for me, but I do think there are some issues that have been very difficult in my family and my personal circumstances that keep it coming back.
Sandy is going through the painful stages of examining losses in her life, a common cause of depression. She's identified many of her problems as stemming from her relationship with her mother, who taught her that happiness comes through others. While Sandy was in high school, her mother unsuccessfully attempted suicide.
The things that I felt towards her, I was simultaneously feeling towards myself. I lost respect for myself. I became angry at myself. I began to blame my father. His participation in their relationship must have been the reason. And so it became my mission to find somebody who would take care of me much better than my father was able to for my mother. So not bringing that baggage to somebody has been a challenge.
Depression slows people down. Decisions become more difficult. Commitments are hard to make. Depression can also make you feel sick. You can be tired yet unable to sleep. You can also have frequent headaches, backaches, and digestive trouble. A national study has found that depression is more disabling than most chronic physical conditions. Depressed people report more days in bed and feel more physical pain than patients with back problems, angina, or diabetes. Sandy's early years of not feeling worthwhile and her mother's attempted suicide led to questions that need to be answered. At this time, Sandy has still not been able to talk with her mother about the past, and she's realizing how much she needs to in order to go on with her future.
How did she really feel about herself? How much of what I experienced growing up, how much of it was, how much of what I absorbed was healthy, and relating in terms of relating to other people. What caused her depression? I asked the question over and over again.
Sandy's questions are important to her because the answers suggest the cause of Sandy's problems. By far the greatest risk factor for developing depression is a family history of it. Robert Santulli.
How much is it genetics? How much is it that if you were raised by a depressed parent, you may well become depressed yourself. Both seem to play a role. Depressed mothers, let's say, aren't often able to give the same kind of nurturing to children that non-depressed mothers can give, and that probably leaves a child more vulnerable to depression than otherwise, but the genetics also...
It's now believed a genetic, biological vulnerability can be set off by one or more stressful events. Events like a parent's death when you're young, a divorce, or a long illness. Anthony Rothschild is a psychiatrist at McLean Hospital, a private psychiatric hospital in Belmont, Massachusetts.
Because some of the effects we're finding are long-lasting. In other words, if someone's been under severe stress, that the effects can be present for many, many years after the stress.
Depression can also be set off by a biochemical change inside the brain that has nothing to do with outside stresses. Researchers are looking at how a number of neurotransmitters convey messages within the brain. A deficiency of one of those neurotransmitters, serotonin, may be linked to depression. Evie Barkin's depression was diagnosed as endogenous, which means the cause is linked to a disorder in her brain chemistry rather than to any outside stress.
Everyone experiences some depression, but nothing like mine. I was unable to function. I can understand that my family didn't understand because I didn't even understand. I felt very detached from everybody. I became very suicidal. I didn't want to live because the pain was too much.
In the 1950s, antidepressant medications began to be used to treat severe cases like Evie's. There are now about 30 different prescription drugs. They're all effective, but differ in their side effects. The oldest and most common type of antidepressant medicine is called tricyclics, which act on several brain neurotransmitters, serotonin being the most affected. There are also MAO inhibitors that block the action of the MAO enzyme that breaks down the neurotransmitters known as amines. Fluoxetine, otherwise known as Prozac, is one of the newer drugs that acts specifically on serotonin with fewer side effects. Evie Barkin had been in therapy her entire adult life and had tried just about every antidepressant with no success. She was put on Prozac in an experimental trial. Prozac has gotten tremendous attention since it was released in 1986. It's helped many people who could not take the other antidepressants. Because it has fewer side effects and is more difficult to overdose on, many physicians have prescribed it. 650,000 prescriptions are written every month. But there are a number of lawsuits against its manufacturer from people who claim it made them more aggressive, violent, or suicidal. Because Prozac is so new, long-term consequences aren't known. But for many, many people, the drug has made major improvements in their lives.
Prozac really sort of put me on a stabilizing level where I was able to learn to deal with depression and speak well in therapy about myself. I was able to have more understanding because I could concentrate better. And when you can't concentrate, you can't, no matter what a therapist says to you, you can't really understand or help yourself.
Depression like Evie Barkin's, that results from biochemical changes in the brain, has been documented in children as young as 3 years old. Carrie Wheeler is 16. She likes to dance to rap music, but only recently felt good enough to be interested in it. She started having problems in 5th grade.
It never fully went away. I mean, it would like kind of go into remission, like cancer or something.
Carrie would have, I would say, fits, and I mean the fits would be, she'd get very frustrated, very angry, and so she'd almost literally throw herself on the ground in this, temper tantrum. That's what we thought.
Carrie's parents divorced when she was 2, and her mother remarried when she was 5. She had a difficult time adjusting to a new father figure, and had more problems when a close grandmother died. She suffered from both depression and separation anxiety. Having more than one problem is common in adolescents and even very young children. Norman Alessi, director of the Child and Adolescent Affective Disorders Program at the University of Michigan, says that makes diagnosis of depression difficult.
But if you have someone who looks depressed, and let's say they do have attentional problems, and they even meet a diagnostic criteria for attention deficit hyperactivity disorder, that means that someone might just pick that. Or let's say if they have conduct problems, that they may miss the depression. Or if they have school phobias or difficulties separating from their parents, they may miss the depression.
Diagnosing the problem is more complicated in the very young, who may not be able to express their depression. And they may not look sad. Instead, they may be irritable or angry or have nightmares. So far, there's been little research into how antidepressant drugs affect children, so physicians are very cautious about treatment. Because teenagers often try to harm themselves, we hear more about their depression. After years of problems with no success in psychotherapy, Carrie tried committing suicide. Her parents placed her in a psychiatric unit for adolescents.
Because I felt very guilty at first.
Like it was your fault?
Oh, what did I do wrong? I got the divorce. I'm sorry.
Because I didn't really like her at the time. I didn't like my whole family. I don't know, I mean, everybody was angry and hurt, and I kind of felt guilty about it too, because, I mean, I felt guilty about it. I felt like everything was all my fault, and I had done this to the family.
Depression puts tremendous pressures on everyone in a family. The guilt that often accompanies it is the result of our society's judgment that mental illness is a personal weakness. It is not. It's a documented disease that results from physical changes in the brain. Carrie had both individual and group counseling and was put on a tricyclic antidepressant. It gave her tremors and increased her suicidal thoughts, so she was taken off that one and put on Prozac.
When she started taking the Prozac, it was like a flip-flop. I mean, 360. She just was flying high. She felt it was something to walk in to see her feeling so good, a smile on her face. I was upset, though, the fact that it took a medication, you know what I mean, to make her feel good. That bothered me. That's just my thing with drugs. And until it was explained to me what the Prozac did, the biochemical changes that it did with the serotonin and, you know, the releases in the brain and stuff, then I understood.
People usually stay on medicine during their period of depression and for a few months afterward to prevent a relapse. Some people may need medicine throughout their lives. It helps to lower anxiety and sadness so they can confront their fears. Medication can correct the biology, but patients still need to deal with things that lead to depression. Group support can help.
Just being in like a group surrounding with all the other kids, to know that I wasn't the only one who had things like that wrong with me. I finally confronted a lot of things that I had been keeping that I wouldn't deal with before.
Like what?
Things that had to do with my family, like in family therapy, feeling left out of the family, and like there was more attention put upon other people than me.
Support groups offer people the chance to share their stories, to not feel so alone.
The day treatment center that I was in for 5 weeks really helped me.
Yeah.
This is a support group meeting of MDDA, a national organization for people suffering from depression and manic depressive illness. Manic depressive illness is called a bipolar disorder because patients move between the two extremes of depression and mania. Unipolar describes people who only experience depression. Evie Barkin helped to start this local group. Members can attend lectures on medications and research and get a chance to talk about their needs. Juliet is on medication, but also needs to reorganize the way she approaches problems.
I had to work on my thinking a lot, you know, to think more positively and to push myself a lot, because, you know, if I mess up one day and I just sink back into depression and I feel that it might happen again, but I just have to try and tell myself to get going even when I don't feel like getting up out of bed.
Mm-hmm. I always thought of the worst things first, and I've learned through my own cognitive therapy that I use myself to think more positively about and things are more positive.
I would like to get to the point where I'm off of medication. I'm working on that. I'm feeling fine now on my medication, and I hope that eventually I'll be able to get off of it because I do want to have children.
For me, I will probably have to be on lithium for most of my life, or the rest of my life, but I don't let that be a problem because if it can keep me to be comfortable and more stable, then that is what really counts.
The connection between talk therapy and medication is very close here. Members often share what helps them deal with their depression.
I try not to make long-term commitments that might bother me, that might make me anxious or panicky.
Toby, how is Elle doing?
She's doing better for the present. Hope it lasts.
The group is also open to relatives and friends of people with depression and manic depressive illness. Toby Johnston's wife, Eleanor, has had chronic depression since the beginning of their marriage.
She seems to have about a 6-week period when she's doing okay. Yeah. And then, out of the blue, comes on her again.
Eleanor Johnston has fought depression and nausea for 50 years. Up until 6 years ago, her doctors didn't know the depression caused the nausea. Eleanor's case has been difficult to treat. Neither psychotherapy nor medications have been able to stop her fears of isolation.
I was very afraid to be alone, and there are times now when I am. When I'm sick, I'm very afraid to be alone. My worst problem is the nausea. Some days just wanting to roll over and call it quits.
Did you ever have psychotherapy?
No. What?
Yeah, you've had that.
What?
You've had psychotherapy.
When did I have that?
Well, you've had it a number of different times. When you were seeing that doctor.
You know, it's amazing. There are so many things when I have it that I'm not aware of, that I've had, like psychotherapy. I don't remember having it.
Learning more about it does help with the patience that it takes, because things are constantly changing. And we make plans, and then we unmake them. We make plans, then we unmake them, depending on how she's feeling. And
researchers are working to offer more help to people like Eleanor. In sleep labs, they're finding most depressed people have abnormal sleeping patterns. The rapid eye movement cycles in which they dream appear earlier in the night after falling asleep and are more intense, which is the opposite of people who are not depressed. Other researchers are using sophisticated tools to measure changes in the brain and adrenal glands. Data like this may help them develop more effective medicines. Understanding how antidepressant drugs work and interact is critical in the elderly. Alan Mello is director of the geropsychiatry program at the University of Michigan.
Those agents need to be used in different dosages, agents with different spectra of side effects, because the elderly can often be more sensitive to those side effects.
Depression is often caused by loss, and the elderly experience loss more often than any other population through death, jobs, and illness. Sadness from these losses is natural, but when it lasts for months, it becomes depression, which is not normal. In the past, we've assumed depression is a natural part of the aging process, and many elderly people went undiagnosed and untreated for years.
Whether depression is part of the aging process, the answer is emphatically no.
You don't have to expect to be depressed when you're elderly.
Absolutely not. Absolutely not. And furthermore, the notion of an 85-year-old recovering and rehabilitating from a depressive episode and going back to their normal life. Now, it isn't the life they had when they were 30, there's no question about that, but going back to an active life is a reality, and should be a reality.
Depression in the elderly may look different than in the middle-aged. They may not look sad and only appear withdrawn or uninterested in things around them. If they complain about an illness out of proportion to the reality of it, they may be depressed. People with Alzheimer's disease can suffer from both dementia and depression.
Although we currently cannot treat the symptoms of dementia, we can treat the symptoms of depression that complicate a dementia illness. In many elderly patients who may be very sensitive to the toxic side effects of medications, electroconvulsive therapy may be a preferable form of treatment.
Electroconvulsive therapy, today known as ECT, but in the past called shock therapy, has changed a great deal from its early use. The film One Flew Over the Cuckoo's Nest warned Americans of its dangers. But physicians say the treatment is much safer today because of what they learned in those early years.
The way it's given today is completely different. It's given under anesthesia, so the person is asleep. There are muscle relaxants given, so you don't have body parts moving and so forth.
You're going to go off to sleep now, right?
In the old days, people often might break an arm from the seizure. The only thing that moves now is one of the small fingers will move a little bit. And it used to be given on both sides, what's called bilateral, pretty commonly. And nowadays we tend to, if we can, for the most part, give it unilateral on one side of the brain, which cuts down on the memory problems that used to occur very frequently back when it was given bilaterally.
Carol, your treatment's all done. It's all out.
But the kind of memory problems you get from it are forgetfulness for what one did that morning, what one had for breakfast, and so forth. People do not forget who they are, what they did, and longer-term memories.
Today, there are many different forms of treatment for depression. ECT is used for only the most severe cases. Most people are helped with talk therapy and antidepressant medications. Today, no one should have to be stuck in the darkness called depression.
Thank God I'm back to the new Evie now, and I want to help people with the illness. I want to help people get through and give people hope. And I never felt better in my life.
And the happiest day, I think, in my life was the day that the scientists discovered that I had a biochemical disease, and that the people who were saying to me, you can talk yourself out of this, were wrong. And I was right when I said, I can't, I need help.
I think it's helpful to be around people, but I think that there's a certain amount of time that I need to be alone. There's a certain amount of time that I really need to just stay. I mean, without sounding really morbid, I think there's a certain amount of time that I just really need to stay with the depression and not run away from it, and to just really take a look at what it's asking of me, because I really think of it as almost like a visitor who wants to be heard.
We have an underlying deep love for each other. Yep. It's always there. I can count on that.
That's true. That's always been.
I can count on that. And he can count on mine.
I guess I just look at the way I was and I don't want to ever be like that again. Because I like life too much now. I like doing things and going dancing and stuff. It's fun.